Well, it is Prostate Cancer Awareness Month in September, and a lot of people still have questions about who's at risk for it and what they need to do to take precautions. Well, we have Dr. Koushik with us this morning from the Austin Diagnostic Clinic to talk a little bit about risk factors and how people can help themselves. Good morning. Thanks for joining us.
Good morning, Jenny.
All right, so Prostate Cancer Awareness Month. Obviously, there are things that doctors want men to know, how they can take care of themselves and who's at risk for prostate cancer. Let's start with the basics.
Right, so about 200,000 men this year alone will be diagnosed with prostate cancer, and of those 200,000 people, about 30,000 people could die from prostate cancer, or about 1 in 7 men.
Wow, so who's at risk for it? Is it a genetic trait that's passed down, or are there lifestyle changes that people can make?
A little bit of all of those things. First of all, men who have a first-degree relative, so someone with a brother, an uncle, a father, those people could be at higher risk. African Americans, and yes, genetics also play a risk, so people that are obese, people that have higher fat in their diets. We found that people from Western countries, like the United States, have a higher risk of prostate cancer than those from Eastern countries like Japan, etc.
And that's probably because the higher fat in the diet.
Correct, yeah, the activity levels, vegetarian diet versus a meat and fat-based diet, things like that.
Okay, so a vegetarian diet helps out there. That's interesting to know. All right, so obviously people want to know, though, when do you need to start getting screened for this? What are some symptoms to prostate cancer? What can they look out for?
Right. When is somewhat controversial lately, but now we're saying roughly between the ages of 40 to 50, depending on your risk factors. If you don't have any risk factors, you should start at the age of 50 and get that done yearly. If you do have risk factors, we encourage you actually to start earlier, between the age of 40 to 45.
And what are some symptoms? What are things that people can look out for?
Right. Interestingly enough, the risk factors from prostate cancer, you often don't feel symptoms until you're almost late stage, i.e. back pain or other symptoms of urinary pain. Could be those of advanced prostate cancer. That's the reason why, one of the reasons we encourage people to get early prostate cancer screening is because we can catch you years before you become symptomatic. And then basically, if we catch you early, you can have almost a 90% plus cure rate.
Oh, really?
Correct.
So all those people would maybe survive if they just caught it early enough.
Exactly.
Okay, okay, that's very interesting. So you're encouraging people to maybe go check with their doctor, find out if they need to get the exam and if they're at risk. And when you say risk factors, you're talking again about if they have a genetic predisposition to it.
Correct. African American, first-degree relative with prostate cancer.
Okay, a lot of good information. Go check it out. It's Prostate Cancer Awareness Month, so this is a good month to study up, learn all your information, and go to the doctor if you need to go see them. Thank you so much for joining us this morning, Dr. Shaw. Always appreciate that.